Anxiety and depression, a biochemical approach to treatment. As an initial presenting variable here, I want to share with individuals that distinctive biochemical imbalances typically are present for most people with anxiety, depression, or mood disorders. So while I'm pretty sure I'm preaching to the choir here, I want to make it very clear. What we understand now is that what we have traditionally called psychiatric disorders, and by definition, when you've done all the testing you know how to do and you come up with nothing, then something is said to be psychiatric. However, if you test and you can find underlying causes, then it's no longer a psychiatric condition. It is a medical condition. Now, here we've got 6 different sources of imbalances or challenges that can now lead to symptoms of anxiety, depression, or mood, just to get started. So, by definition, these are no longer psychiatric disorders, these are now medical disorders. The first one that we talk about, actually, I'm going to separate those two. We're not really looking at copper zinc imbalance. We're looking at copper by itself and then zinc by itself. And I bring that up because a lot of people get confused and they're saying, I see a copper zinc balance of 1 to 1, so everything should be okay. No, that's not correct. If your copper is too high or your zinc is too low, no matter what that ratio is, it can produce anxiety or depression. And then you have to treat it that way. The second one here is undermethylation. A lot of you have heard about methylation disorders and undermethylation. Yes, that can cause anxiety and a spectrum of disorders all the way up to schizophrenia and bipolar disorder. Overmethylation, the exact opposite of undermethylation. Many people have not heard about that, but it exists. It's real. And as a matter of fact, there are personality traits that go with both undermethylators and overmethylators, and they are diametrically opposed. But here's why you don't treat anxiety or depression as a term, because the treatment for undermethylation is diametrically opposed to the treatment of overmethylation. So you must know the underlying cause in order to have successful, consistent treatment and an improvement for your patients. Number 4 on the list is pyrrole disorder. That's gone out there in the internet, if you will, and a lot of you have heard a lot about it. We'll talk more. Then we talk about toxic metal overload. Everyone's heard about those. And then the really key piece here, severe oxidative stress. That's what we call rust at a cellular level. So when we talk about nutrient deficiencies that impair brain function, I want you to think about deficiencies only, not excesses. When we see deficiencies, we reference, for example, deficiencies in zinc. You know what? You can't make serotonin, that wonderful brain neurotransmitter, without appropriate levels of zinc. Now, pharmaceutical medications, they tend to improve the level of serotonin by way of stopping its destruction. But what we do is that we look at what do you need to make serotonin in the first place? Now, many of us have been taught, well, the rate limiting reaction involves this rate limiting enzyme. Hold on here. That enzyme is a horse that needs a rider. The rider of that horse is zinc. So low zinc levels will lead to low serotonin levels. And that's oftentimes how you can get anxiety or depression. Methionine deficiency is also very important. That's one of your main methylating agents. Now, folic acid, that's one where if you are an overmethylator and you're low, then it becomes a problem, not if you're an undermethylator. Vitamins B6 and B12, both very important in the production of neurotransmitters as well. Niacin and niacinamide, same. DHA, essential fatty acids, DHA, EPA, and so forth, arachidonic acid. They're all very key in the right places and in the right conditions. But I can tell you, if you've got an issue with one of these agents and a different chemistry involved, you're going to have difficulty in the production of neurotransmitters and therefore in mental health. Also, antioxidants like selenium, glutathione, vitamin C and E, etc., are very critical. And so is chromium. Nutrient overloads that impair brain function. The first one that we're going to talk about is copper. I want everyone out there to know, if someone has a mental health condition or has been classified as having mental health, and you test them and you believe that they are low in copper, do not give them copper. I'm going to say that again. Do not give them copper. Copper takes your neurotransmitter dopamine and turns it into norepinephrine or adrenaline. There have been people who are given copper who have been sent to the emergency rooms with panic attacks, anxiety disorders, and guess what? High or elevated heart rate. So copper has put people in hospitals. So please don't give copper if you see it low. If it's high, yes, it's time to bring that down. And there are biochemical means to do the same. Okay. Too much folic acid. Ah, many years ago, we talked about the effects of folic acid. People don't recognize, they know it's a powerful methylating agent, right? But what you don't realize, many people don't know, is that at the level of DNA, not outside the cell, but inside the cell, the level of DNA, the nucleus, folic acid is a D agent. I'm going to say that again. It is a powerful methylating agent. So it acts one way in the cytoplasm of the cell, where it provides lovely methyl. Then when you get to the nucleus of the cell, it removes 10 times as much, 10 times as much methyl as it ever gave. So in functional perspectives, consider folic acid to be a demethylating agent. And think about it. We've seen the incidences of both autism and ADHD increase over the span of the last 20 years. Children who are autistic and children who have ADHD are usually under methylated individuals. The vast majority, 85 to 90%. Now, let's look at during that same time course, what happened. During that time course, we started recommending the use of folic acid prenatally and natally and postnatally all at the same time. So while we're increasing the use of folic acid in our pregnant moms and nursing moms, the rates of autism and ADHD were increasing. It's not coincidence. We'll talk a little bit more about that later. Iron. Iron overload does indeed present a problem. We'll talk more about that a little bit later. Methionine and SAMe, absolutely. Too much, not a good thing. We'll get into that later. Toxic metals, you guys know this one. Lead, mercury, chromium, etc. Cadmium, etc. All these are important overload considerations. When we talk about the effectiveness of targeted nutrient therapy for depression, a lot of this work comes from my mentor, Dr. William Walsh, PhD of the Walsh Research Institute, where we talk about biotypes that are present in different disorders, each with very unique neurotransmitter imbalances and symptoms. Now, here's the key. We talk about bioindividuality because you need a separate treatment approach for each biotype, okay? Outcome studies reveal about 80% of patients report nutrient therapy to be very effective and the ability to reduce or even eliminate medication. This is from Dr. Walsh's book, Nutrient Power. Let's look here at this graph just to give you an interesting picture of what's going on here. We talk about depression specifically, not anxiety, not schizophrenia, not bipolar, but depression. We see that 38% of depressives are usually undermethylated individuals. They're in the blue. 20% are individuals with folate deficiency. Another 17% are those with copper overload. And then 15% are usually about pyrrole disorder in the purple. And then we have 5% and 5% toxics and other things. So here's what I want everyone out there to understand, because we have a lot of patients who come in and they'll talk about they were treated for toxic metals and they were treated, but they didn't do better. Folks, the reason is because most of the time, as you can see by this graph, most of the time depression is not caused by toxic metals. It's caused by biochemical imbalances. And in particular, those four: undermethylation, folate deficiency, copper overload, and pyrrole disorder. Here's something that we also have to recognize, and this is called normalcy, okay? In the general population, 70% of people actually have normal methylation. We're so used to being trained to talk about the pathology, we don't recognize the normalcy, okay? But 22% of individuals are what we call undermethylated. And then 8% are considered to be over methylated. So keep in mind, if somebody doesn't have a mental health challenge or any other kind of issues per se that are very out there and prominent, you have to consider that most people in the population are actually normal in methylation, over 70%. For those who've got some type of pathology, most of them are going to be undermethylated individuals. That's that 22%. And then 8% are going to be over methylated. Okay. Now, about 70% of individuals with mental disorders, mental health disorders, do exhibit a serious methylation disorder. Okay. So remember the categories. Of those who got specifically mental health challenges, 70% have a methylation disorder. Patients who are overmethylated tend to have a very high anxiety tendency. Panic often sets in, depression, a variety of things. Now, individuals who are overmethylated are oftentimes associated with high levels of serotonin and dopamine activity, with an intolerance to SSRI medications. Now, what I just said, I want everyone to really understand, because here's a very big clue. When we talk about intolerance to SSRIs, many of us have had those patients who said, hey, I was given Prozac, I was given this medication, I was given that. Nothing helped me. In fact, I just couldn't handle it too well. That's a clue that they may be over methylated individuals. And so you have to look at a very different capacity to treat as opposed to looking at this from this perspective. But let's talk about the characteristics of overmethylation. And all these things are here. These are scientific documentations about the kinds of symptoms you may see. But that's not the big picture. Okay. The big picture is what really separates overmethylation symptoms from undermethylation symptoms. And I want you to hear me more than anything else. If you look on that second column, the ability to be artistic or extreme musical ability, high creativity. These are some of the personality traits that you see with an overmethylated person. These are oftentimes the musicians, artists, poets, philosophers. These are architects. These are individuals with extreme creative prowess. They tend to be over. Why is that? Remember, we're talking about increased serotonin and dopamine activity. Their brains are spinning like no one's business in high gear. And they come up with these great ideas. In fact, these are the people, if you want a creative solution to a problem, talk to an overmethylator. Okay. Now, they do have depression, but so can several other disorders. I want you to focus on those symptoms that uniquely point you to the question of, is this an overmethylated person versus an undermethylated person? Okay. You know this one too. Your child or your friend's child is just a brilliant kid, but they're a straight C student. Why? Because they really don't care. They're like, hey, you know what? I really don't have to prove myself. I know what it is I can do. And yes, when the SAT comes, I scored 32,000, and the ACT comes and I've got a 72 out of 33. They're brilliant, but they don't like doing the day-to-day work. Highly creative. Those individuals are likely overmethylated people. So those are oftentimes many times the benefits of overmethylation. But when it comes to challenges, paranoia can be there. And please note this, obsessions without compulsions. See, undermethylated folks typically have OCD, but individuals who are overmethylated, when they have it, they tend to be obsessive without the compulsion. Okay. So now we're seeing how chemistry directly reflects more or less your diagnosis better. Okay. Undermethylation. Okay. What I want you to remember about undermethylators is perfectionism, OCD. These are the individuals who have to dot the I's, cross the T's. They walk in a room and that picture is not perfect. Even if it's not their own house, they're going to want to go ahead and fix that little picture. Everything must be well organized or they can't function. Everything has got to be in place or they can't function. And they're usually very intelligent people. They are the ones who score a billion on any aptitude test, but they're the ones who do their homework every day. That's with extreme perfectionism. They dot the I's, cross the T's. These are, I'm so sorry to tell you folks, these are our scientists, our doctors, our lawyers, our engineers. These are the people where detail analysis comes into play. Here's one for you. School teachers, your educators. Remember them? Mrs. Smith from fourth grade? Oh, that woman had to have everything in place, right? That person was just that kind of tight on detail, right? So high-powered salesmen, believe it or not, are also usually, they've got the details about how to work you through any kind of sale without an issue, okay? But here's the challenge. Undermethylation can also lead to addictiveness. Highly addictive individuals are usually undermethylated. So there are ramifications to knowing someone's methylation status, okay? When we see the social network, unfortunately, undermethylated individuals are usually socially or can be very socially isolated, okay? And this is a different territory here, but when you look at individuals who've got Asperger's syndrome, as we used to call it in the older days, Asperger's is a condition of social isolation. Highly intelligent individuals, they often don't understand social cues, and therefore they become socially isolated. And that's actually because of poor development in the amygdala cortex and the insular cortex in terms of just growth. Intelligent, but not socially aware. And that can lead to isolation. That can then lead to depression and an extremely heartfelt pain every single day because they know something's not right, but they don't know what to do about it. Okay. So chemistry can tell us a lot in terms of our society. Now, is one better than the other? No, we need both under and overmethylators in the world, right? Undermethylators organize the world for us. Overmethylators give color to the world for us. This basically talks about a lab piece involving the SAM-SAW ratio, whole blood histamine. We'll get to that a little bit later. Let's talk about genetic mutations because a lot of you out there really are just very high on genetic testing now and SNPs and so forth. So I want to share some very important axioms for you. Okay. The impact of an individual SNP varies from person to person. And by SNP, we mean genetic mutation. Now, in med school, we're taught very clearly one SNP usually doesn't have much of an effect, depending on who it is and where it is. Okay. Certainly, strategically placed SNPs can significantly weaken enzyme function. And that's where most people come from with regard to the MTHFR. They think that is that particular situation. And that's not correct. Most SNPs actually have little to no effect on enzyme function. And talking to a whole group of individuals, we were doing a class session and teaching, they asked, well, the SNPs this patient has here, and the SNPs this patient here. And I said, first of all, you have to understand that most SNPs don't actually have an effect. The question is, what system are you looking at? That's very important. Here's an axiom for you. Many folks, unless they're sitting in biochemistry class, aren't thinking about the size of the molecule. The larger the molecule is, the less significance a SNP has on that enzyme function. And the enzyme, the methyl tetrahydrofolate reductase enzyme, is a huge molecule. It is 77,000 kilodaltons. Now, the COMT enzyme, or COMT, is only 6,000. Is only 6, not 1,000, 6 kilodaltons. So a SNP in COMT will have a powerful effect on the effectiveness of processing neurotransmitters. However, a SNP in MTHFR is going to have next to no effect. Okay. So remember this, the smaller the molecule or enzyme, the greater the effect or the greater the significance that a SNP has on enzyme function. The larger the molecule, the less significance a SNP is going to have. And I know most of you out there are not going to try to analyze whether or not this enzyme is a 77 kilodalton, 77,000 kilodalton or a 6 kilodalton enzyme, but I just wanted to give you a little bit of a background there on what we're talking about and why. Now, pyrrole disorder. A lot of you have heard about this, and I want to share with you some of the axioms and some of the challenges that have been out there in the, I'll call it the ether world or internet, and about pyrrole disorder. So first of all, I want you to think about pyrrole disorder as, for those of you who recognize Bugs Bunny, I'm dating myself here. There's a character known as Taz or the Tasmanian Devil. Think about Taz running amok in your brain, okay? That's pyrrole disorder. It is rapidly cycling moods. It is anxiety, depression, short temper, short fuse, rage, poor consolability. It is having a hard time calming down. It is being highly reactive to the smallest basic stimuli. I want you to think about that Tasmanian Devil from Bugs Bunny when your patients come in and they're sharing with you with either their inconsolability, their rage, their short fuse, or what's happening with their children, okay? By definition, pyrrole disorder is a double deficiency in zinc and vitamin B6. That results in a tendency for low brain levels of serotonin, dopamine, and GABA. And GABA is that calming neurotransmitter, gamma aminobutyric acid. This is a recipe for depression and anxiety. Okay. Remember earlier we were talking about enzymes and how they act like horses, and that you've got to have a rider on that horse to direct it. Zinc and B6 are riders on the horses of enzymes that are part of neurotransmitter production. If you have low zinc and low B6, you're going to have low brain levels of serotonin, right? Your happy neurotransmitter. But you're also going to have low levels of GABA, gamma amino acid, which is your calming neurotransmitter. So if you have low levels of your happy neurotransmitter, but you have low levels of your calming neurotransmitter, you can get anxiety. But that's also why you also have depression as part of pyrrole disorder. Okay. You will hear symptoms quite often of sensitivities to light, odor, sound, or texture. But I gave you the acronym LOST: light, odor, sound, texture. These are some of the 4 key symptoms that you see that are more physiologically based with reference to pyrrole disorder. That's the clue. Kids come in, parents say, oh, you know, that kid smells everything. Everything's got to be tasted beforehand. They're sensitive to light. Odors bother them. When we're at the dining table, we're chewing. They can't stand it when we chew at the table with them. They've got to run away. check for pyrrole disorder. These individuals oftentimes have severe inattention, delayed puberty, sensitive to loud noises. Here's something for you guys to see. Severe oxidative stress. And I want to share this with you. That is not always so much about mental health. That oxidative stress piece can come into play when we're talking about physiologic challenges. So you test somebody in their pyrroles. Now we use a pyrrole testing that's sensitive up to about the number 50. But you get somebody who comes in at a 95. Immediately we pause because it's not just about mental health. Oxidative stress increases pyrroles. So now we start thinking what systemic disorders might be happening here. Cancer. I am very concerned when I see an adult person over the age of 50 come in with pyrroles at 80 to 100, because somewhere in there usually there's a carcinoma. Very concerned. And our first thing is, did you talk to your primary provider? Have they done any kind of testing? What are your symptoms? What are your signs? What's been happening in life? But not just cancer. Severe thyroid or adrenal dysfunction can also manifest with pyrroles greater than 50. So we're talking about the urine test and the test diagnosis for pyrrole disorder. It can produce some very interesting findings once you see the spectrum around which pyrrole are a clue to your person's mental health or physiologic health. This is very important. These two words, oxidative stress, are probably the most important words in recent scientific history. Oxidative stress basically creates cellular rust. Now, remember what a cell is biochemically and physiologically. There's the internal aspects of the cell that require normal functioning, which leads to homeostasis, both inside and outside of the body. All right. So when you have rusty cells, stuff leaks out and things come into the cell that shouldn't be there, which now lead to dysregulation of that cell times thousands of cells, which equals dysregulation of the tissue, times hundreds of or thousands of tissues, which equal regulation of the organ. That could be liver, that could be heart, that can be kidney, that can be intestines, skin. Any organ gets to be affected horribly by oxidative stress. All right. Now let's talk about oxidative stress a little bit more in detail here. Excessive oxidative stress is described as excessive release of free radicals that can destroy cells and therefore impair biochemical processes. All of you know about glutathione. Who hasn't heard of it? Everybody knows about glutathione. It's very necessary for proper functioning of the NMDA receptor. Oxidative stress depletes levels of glutathione. And so oxidative stress, when you measure that, if you use a pyrrole test, you actually measure oxidative stress by way of that test, what you're seeing is that there can be cognitive dysregulation. And we know that obsessive disorders, schizophrenia, and bipolar oftentimes are related to the NMDA receptor site. Oxidative stress can destroy digestive enzymes needed to break down casein and gluten, producing inflammation, and that often results in a leaky gut, allowing toxins to enter the bloodstream. And who hasn't heard of leaky gut at this point? Additionally, severe oxidative stress can lead to poor immune function and the disruption of the methylation cycle. When we're looking at evaluating a patient, the first thing we want to ask is, so aside from doing a very detailed and thorough history, we all want to talk to our patients and listen. If you listen to your patients, they're going to pretty much tell you what's wrong with them. The first point we want to consider is what is out of balance. Do we have a possible nutrient overload, or do we have a possible nutrient deficiency, or a combination of all the above? We want to look at metal regulation and sometimes very specific metals like zinc or copper. We want to look at environmental factors or epigenetic factors. Okay. What was done? Were you taking vast numbers of nutrients? Were you taking certain medications? Certain medications can deplete you of nutrients. We'll talk about that a little bit later. Gastrointestinal issues, including food allergies and sensitivities. And is this kid malabsorptive? If you're dealing with a very slight, poorly growing child, you must consider malabsorption as well. Testing for methylation disorders, first test we use is a histamine test, a whole blood histamine, not a plasma, serum, or some other construct. It must be whole blood histamine. For pyrrole disorder, we're going to use a urine test. And what we're looking for is zinc and vitamin B6 levels, mostly zinc that we see in the pyrrole testing. But with pyrrole disorder, we know that there's going to be a challenge between those two. And also, it's going to tell us about oxidative stress and inflammation. Labs to assess. Okay. So first of all, when we talk about direct health laboratories, DHA, we're referencing the laboratory that worked with our Dr. Walsh and the great Carl Pfeiffer way back when to develop these tests. So they are the laboratory that we always go to because they do this well, they do this right. And if you don't have good results or accurate results, you're not going to be able to help your patients. Okay. So when we go to DHA labs, we do the cryptopyrrole urinary analysis to test for pyrrole disorders. We go to LabCorp to do the copper test. That's the serum copper specifically. We do a plasma zinc, and we do a whole blood histamine analysis. Now, there are a lot of tests you can do for a lot of things, but you would be very surprised at how many people you can help with just these 4 tests. This is what I call the basic panel. This is the metabolic panel involving the urine test for cryptopyrroles, the copper test, zinc test, and the whole blood histamine. The whole blood histamine test for methylation. Now, why just these 4 tests? Because each one of these testing processes leads to a domino effect of biochemical and physiologic disruption. Zinc alone is responsible for more than 250 major biochemical reactions in your body. That's not even in your brain, your body alone. So these are very key test processes with many ramifications for anyone to do. All right, great. When we're looking at a patient, we want to do really switch these 2 points here. First, we're going to do an extensive patient history. The history is going to give us a lot of information. Then we do the physical exam. Then we look at specialized laboratory testing in both blood and urine. Then we do diet and GI issue analysis. And then we look at putting together advanced nutrient therapy protocols. They're going to be prescribed at the appropriate therapeutic level. You must be at the proper therapeutic level in order to target the patient's specific chemistries and their needs in order to correct the underlying imbalances that are present. So, as my business partner, Dr. Bowman, would say, stuff not enough is oftentimes a reason for failure. You may put together something, but it doesn't have the right intensity of the dosage of the nutrients you're given. And I do mean dosage. You're not going to have the results you're looking for. But you also have to be very careful about excesses. So learning what is the standard treatment level for each of these nutrients is very important for each condition. So here's an interesting little presentation about the testing process. So you see some numbers here. We did a cryptopyrrole test, copper, zinc, and whole blood histamine. You see that copper there in the green, that's 138. Our boundaries for, now this is the chemical testing from the lab. Now, the reference range, the Walsh-Pfeiffer functional range is what we look at. That's what's going to tell you what you need here. Okay. So you see there in the far right, it says 170 to 110. No one should be above 110. If you are above 110, you're copper toxic. What does that mean? You can have anxiety, depression, rage, panic. And forgive me if you're a female, this can often be associated with fibroid tumors, endometriosis, adenomyoses, and very severely, breast cancer. Okay. Why? Because copper is responsible for blood vessel development in the body. And if you have an elevated copper, you're going to produce blood vessels. Blood vessels feed tissue. Tissue leads to growth. You guys follow me? So high copper levels take a detailed, not just mental health history, but physical history of females that you're dealing with. Okay. And you may find some very interesting family histories of fibroids or endometriosis or breast cancer or so forth. In fact, those are guidelines when we're doing an initial history and we start talking about family history. That actually points us to the fact that this patient may have anxiety, depression, rage, impulsivity, or agitation because of a copper dysmetabolism. Okay. Now then, histamine. There you see that test says 128 in the gold. Okay. Our borderline is from 40 to 70. Higher than 70, a person is under methylated. Lower than 40, a person is actually over methylated. So we see here in this case, this person is 128. They are severely undermethylated. Would not surprise if this person had severe anxiety or OCD tendencies very prominently, or bipolar disorder or schizophrenia. That's a very important number. The next category, we see zinc. Below the number 90 is low for zinc. And zinc does so many things that if the person is at an 89, you say, but just borderline. No, optimal is about 120. So now if you're looking at 84 versus 120, knowing that's what optimal is, and you know that zinc is necessary for proper neurotransmitter development, that's a low number. that person is not only zinc deficient, they're now hindering themselves from any function that requires zinc, including physical growth, growth of hair, nails, wound healing, anxiety, depression. All those pieces involve zinc. So if you're low in zinc, there are a lot of ramifications around that. Anything over the number 10 with that cryptopyrrole analysis, this is a 31. This person has got severe internal tension and severe stress. They might also have severe rages. They might also have poor capacities to calm down. They may also have anxiety, depression, cycling several times a day. This is a very big problem. In this case, by the way, every single laboratory we've talked about, from the copper to the zinc to the whole blood histamine that shows methylation to pyrroles, any one of those can produce anxiety by itself. Any one of those can produce depression by itself. Here we've got 4 chemical analyses that show severely elevated or deficient. And now we're looking at the compounded causes of anxiety, depression, or mood dysregulation in a patient. All right, so let's overview the treatment process. Once again, first we need an extensive history. Then we need a good physical examination. Then we need that specialized laboratory testing in blood and urine. We want to check for dietary and gastrointestinal issues and sources. And we want to put together the appropriate nutrient protocol to help address these underlying biochemical imbalances.
Welcome to Rupa Health, the best place to order, manage, and track results from over 30 different lab companies in one single place for free. It's going to take you under 2 minutes to sign up, and you can order any functional medicine lab for your client in under 30 seconds. Let me show you how it's done. So here's our beautiful interface. I'm typing in the name of my client, selecting the lab that I want to order for them, and hitting send. From there, Rupa and their amazing team handle the rest. They email the client, collect payment, and even offer an interest-free 3-month payment plan. We've also built the world's largest library of information about chronic health conditions, the lab tests that can help you find the root cause, and the evidence-based interventions that you can use to help people heal from them. It's called the Rupa Health Magazine. There, we have in-depth articles about almost any health condition you can imagine. And we give you step-by-step protocols that other clinicians have used to help their clients heal and that are verified by evidence-based sources. You should totally check it out, and it'll transform your practice. And we can't wait to see you. So make sure you sign up today at rupahealth.com.